I'm Muhilan, as Soraya and Alvin just told you. I, I'm a urologist by training, but I have a special interest in men's health and wellness and anti-aging and stuff like that. So, right now, the hot topic, right, even for guys is, right, do we really die that much faster? I mean, like every day in the news, that's what we're discussing, right? 40 something dies. My brother in law's classmate, 49, was shopping and just went, right? And recently there were doctors who passed on fairly young, 50, 52. This scares me a little bit because I'm 51, right? And am I next on the list? So a few simple things, right? Number one, don't assume you exercise 100 hours a day, you don't smoke, don't drink, and you're not going to get a heart attack. It doesn't work like that. There are so many other things that lead to heart attacks and strokes that we don't know. So it's a good thing, exercising, control your diet, don't smoke, don't drink, but it doesn't mean you're zero risk for getting problems. So number one, what other factors will affect us is stress. Now telling you stress fairly easy. Controlling stress, I just telling Alvin, I can't tell you to change your job, I can't tell you to change your wife.
Yeah.
I can't tell you to throw the kids in a dustbin and run away. You can't. Not gonna work, right? So stress management, we do what we can with what we have. What you can add in is a checkup, right? It's really simple, right? So at 50, you're a guy, what do you worry about? You worry about getting a stroke, getting a heart attack, and getting a cancer. One of three. Cancer is not going to suddenly kill you, right? That's got time, that takes time. So the sudden thing is heart attack and stroke. So if I'm okay, when I was 40, I'm okay, a little bit more paranoid. Obviously, I've got more exposure to mental. 43, 44, yeah, 43, 44. To be honest, my lifestyle sucks. I have wife, two kids, trying to provide for them. Work sucks. Sleep time sucks. If I can get 4 hours, I'm happy. And I got, the usual list of bad habits. So about 40-ish, 43, I decided to, since I can't do a full change of my life, let's be honest, a lot of things I wasn't going to change. I decided to do regular checks, and this is easy. Go to a hospital near you, go to a doctor you're comfortable with, do something simple, do a stress test. They just put you on a treadmill and jog. What that tells you is blood is flowing through your heart and through your brain enough to keep you going and doing an active day. Simple, right? Takes 30 minutes, bring some shoes. A blood test. Look at your cholesterol, look at your kidney, look at your sugar. All good, come back in 5 years, repeat. It's not perfect, but it will pick up most major problems. It's not going to pick up a minor problem, it'll pick up a major problem. Repeat every 5 years. So I'm just being realistic, right? Because I know most doctors tell you stop the smoking. If you haven't stopped by 45, chances of you stopping is pretty low. If you're a workaholic at 50, yeah, you're probably going to be a workaholic for another 20 years. And if you need money at 50 to pay for the kids, that's not going to change in the next 1 or 2 years. So realistically, you're not going to change much your lifestyle. I'm just being real. And Surya asked me, are we hiding from the fact? No, it's not that. Guys don't think about this. I don't think I'm going to die tomorrow. We assume we're immortal and going to live forever. Right? But what you can do without too much hassle is take a Saturday, go to a cardiologist, go to hospital. Obviously, I'm from Thomson, so I'll tell you come to Thomson. But yeah, pretty much go to a hospital, a doctor you're comfortable with. Stress test, blood test. It's good. Come back in 5 years. Not difficult. I think this we all can do, right? Pretty much.
Definitely.
Right.
Yeah. Why 5 years, sir? We heard some other doctors recommend do it like every year or at least 2 years once.
So 5 years means you're clean. So let's say you go to stress test, Alvin can jog level 5. Level 5 means you're full out there, you're pumping it in. ECGs are good. The echo is good. Your bloods are perfect. Let's say you start developing a blockage of your heart the day after your stress test. For it to even see it, that'll be about 4 or 5 years. If I did, let's say you got family history of colon cancer, and I did a scope for you, and your scope is normal, and the cancer started growing. For me to even see this cancer, right? Minimum 5 years, significantly. 3 years, maybe you can see a small guy. 5 years, you can see it. So I said 5 years. But let's say you come in. Okay, I do a stress test every year, mainly because I have high cholesterol. I am a diabetic. So, like I said, I'm not the best role model. So, in my case, do what I tell you. Don't do what I do. Okay, really, don't do what I do. Right? Do what I tell you.
Nice.
Okay, so I do one every year because I have a tiny block, tiny, not a block, a tiny hardening of one of my vessels. My cholesterol now is under control with some really good meds. My sugar's under control. But I snore, I sleep apnea. That itself is a risk factor. You know, if you snore at night, if you know someone's a heavy snorer, at night there's a block of oxygen going in, so you're high risk of stroke. Your blood becomes thicker. So that itself is a risk factor, and all of us know someone who snores, right? So I got all these risk factors. So I know disease will progress a little bit faster. So I do mine every year. So if I have risk, like what I just told you, cholesterol, I have sugar, I got a little bit of block, I snore when I sleep, I do a stress test every year.
All right.
Right? And when it comes to making changes, I do make changes. I'm not that bad, but I know myself, so I do small, easy changes bit at a time. So after 50, right, cut back red meat. So I don't eat red meat anymore, which turned out, since it's the only change I made, easy to do. Everything else is the same. Maybe next year I'll make another small change, but these changes add up, right?
Right.
So cut back red meat, my cholesterol's good. I'm happy. Let's go to the next change next year. Next year. This year, no more change. I'm already surviving without the mutton, right? Let's worry next year.
Got it.
Okay.
Now, doctor, you mentioned about doing a stress test and blood test, right? How young should someone start with all of this?
All right. Let's say someone has zilch, zero symptoms, you're a healthy, active guy, right? And no family history, no risk factors. If I'm not paranoid, I use evidence-based medicine. I would say around 40 to 45 should be your first blood test. And that would be the common reason, you're going to look at diabetes, you're going to look at heart disease and cholesterol, right? Based on what you see on that blood test, you then decide to do one once a year or once in 2 years, right?
40 to 45 years old, huh?
To start. I mean, that's a start. Alvin, there's no way you're 40 or 45.
I tell you, doctor, time flies. No, I'm only 30s. In my
Okay,
30s.
so don't look so worried then. I'm not telling you to go for
Doctor, just following up to your statement just now, you said
Right.
the three major worries are stroke, heart attack,
Cancer.
and cancer. Yeah.
Right.
So,
I would go with stroke and heart attack as number one, number two.
yeah, because in terms of cancer, it's something that you can't. I'm just guessing that it just happened. Like, since you mentioned colon cancer, my father stopped smoking after 45 years. Then he got colon cancer. But now when you say heart attack and stroke, can you elaborate more?
Okay, so one thing about cancer, right? The bad news, and what doctors don't tell you is, we make it look like good lifestyle, good food prevents cancer. It doesn't. 75% of cancers are random events. That means with a perfect lifestyle, perfect health, yes, you still have a chance of getting cancer. Okay, that's the cancer part. I just wanted to get that out of the way, right? Okay, so heart disease and stroke, package deal, they go together, right? At its core, both are problems with the blood vessels. So that means either the blood vessels get narrower or they get blocked suddenly. Certain things make it. Now, if you are 90 years old and you have a narrowing of blood vessel, it's something that built up slowly over time. That's the older guys, or older women as well. And that's a slow, progressive narrowing. So people get chest pains, they get shortness of breath, and then the doctor checks them and you find a slow, sudden, progressive block. Young guys, like that, they're jogging, they're running around. So what happens is they already have a little bit of damage to blood vessel. Some stress causes a little bit of that plaque on the blood vessel to get dislodged. It flows, goes downstream, goes to some blood vessel, pop, it just blocks the blood vessel, and that's it. Okay? Certain things we know make this process more likely. More likely. Doesn't mean that if you don't have it, you will never get it. Okay, big one. Stress. Stress is right up there, right? Stress is okay. So there's this video I saw about this cardiothoracic surgeon in India who passed away. 45 brilliant career, 15,000 surgeries, worked 10, 12 hours a day, right? Monday to Sunday. He thought he was safe because a vegetarian, didn't drink, didn't smoke, and he was fit. Problem is, stress by itself damages the vessels. It damages every part of you. And it doesn't have to be physical stress, even mental stress. So, stress. Managing stress, the rule is to remove the cause of the stress. But with your job, you can't remove it. You can cut back, you can work more reasonably, you can add in more rest time, more holidays. But stress is number one. And there's a long story, but basically it's linked to cortisol, blood flow, heart rate, blood pressure. But basically stress, number one. Mental attitude, strangely, this is a big one. So, you'll see this old uncle, 85 years old, smokes 30 cigarettes a day, drinks half a bottle of whiskey, is perfectly healthy, but he's also probably has a really good mental attitude. He's chilled out, relaxed, he's got a good life, lives in a kampong, gets up, sleeps 8 hours a day. And then you got people who are healthy, who look like they're this close to having a mental breakdown. Okay, the guy who's healthy with this close to a mental breakdown is the one who's going to get a stroke and heart attack. So we now know mental attitudes play a huge role. So the reason I'm emphasizing these are the two you can change, right? Controlling stress can be things like yoga, going for a swim, going for an evening walk, buying a dog, buy a cat, get a girlfriend, get a partner. Many things you can do for stress. Okay, I mean, small
Girlfriend
things.
when you're married. If you're when you're married and you get a girlfriend, that one different stress.
They want to add to the stress. They want to add to the stress. But you think about it, we can. Stress we can manage. Attitude we can manage. We can tone it down a bit. Don't be so kanchong. Don't be so. This thing is, you're not going to live extra by being super stressed out. Then the rest is stop smoke. I'm sure every doctor told you this. Alcohol, a glass a day is not going to kill you. A bottle a day will kill you. Right? A glass a day is not going to do harm. And then exercise. People ask me how much I exercise. Look, everybody can exercise different levels. Some people, my colleague jogs 30 kilometers a day. I think he's mad. All right. I'll be amazed if I can do one, but I can do one. So I do one. If you only have 10 minutes to do a slow walk, do the 10 minutes the slow walk. That's what you can do. Telling you my expectation and the ideal world one is garbage. All of us have different lifestyles. We got to do what we can, but do something every day. Even if it is, instead of taking the escalator down to the car park, you walk down the stairs. Not a big deal, walk down the stairs. It's what you can do, but any amount of activity is better than the zero that you're doing now. So I mean, that's my advice. I tend to go towards the practical side of things. I'm not very theoretical. So this is what I tell my patients. And believe it or not, the accumulated change by just a little bit change in mental attitude, a little bit reduction in stress, and just that extra 2 or 3 minutes of exercise a day accumulates. You have this accumulative effect over time. And that accumulative effect over time, 1-2 years down the line, has a significant reduction in your stroke and heart attack risk. And it's not a big a deal. Like I cut down, instead of working every Saturday, I work alternate Saturdays. But I find my blood pressure came down and my cholesterol came down. In addition to me taking drugs, which I've already been taking some time, I found that just because I work alternate Saturdays and I made Thursday a half day, I'm a lot more relaxed. And increasing my sleep pattern, I think I increased my sleep by 40 minutes a day. And my heart rate has come down. I mean, think about it. None of this is big things. I make minor changes.
Yeah, okay. That's true. It's the small things that leads to big result. I like that you mentioned, you do all the small things and then it add up, accumulates later on, right? One thing that I say to my clients is the dominoes effect. When you add a positive habit into your lifestyle, somehow it will affect other things and lead to a healthier you.
It's sustainable. You see, you don't have to try to do this big thing which you can't sustain, which you can't handle, and give up and go to zero. I'd rather just do minor changes, right? And you can keep it up, all right? Um, yeah, it's sort of depressing topic though, but anyway.
No, I think it's great. I think it's great. Now, doctor, I have a question for you.
Yes.
What are some of the common like man health issues, or I would say
Okay.
what are the most famous man health issue that your patients and client comes to you?
Okay. So there are two. So the mental health issues that me, your doctor, am concerned about. So I'm concerned about your heart, your lungs, your brain. And then there's mental health issues my patients are concerned about. It's like one, if you're on the younger side, is like, look, my sex life sucks, I don't have my morning erection. Is this going to end? Am I not going to have sex anymore? Okay, that's question number one. Question number two is like, why on earth do I get up and pee 5 times a day? Okay, do you know how annoying it is to run to the bathroom? I can't sit through a meeting. Okay, so patients' concerns are two. So let's discuss patient concerns. Doctors' concerns, I'm sure doctors have told you enough. So let's start with erection. Okay, let's start with erection, right? So two things. Erection is blood flow, a good blood flow to your penis, and your mental health. So mental health is you wanting to have sex, you're in the mood to have sex, you're not too tired out to have sex, and is driven in part by stress, whether you're stressed out, back to stress, and male hormone levels, testosterone levels. Sadly, Alvin, you're at your peak. All right, I got bad news for you, man. 30 is your peak testosterone. It's all downhill from there. Okay, so testosterone drops all the way down. All right, and when you're 50, it's like some very small amount. So the higher your testosterone, you don't need testosterone to have sex, but testosterone gives you the sex drive. Okay, testosterone declines with age. That's true. How fast it declines depends on how much exercise you do. And I'm not talking about cardio, I'm talking about weight training. So guys who do gardening, who lift heavy weights, who change car tires, mechanics, physical laborers, people who live, go to the gym, they maintain a higher testosterone level. It will still come down, but at a slower rate. Mental stress reduces testosterone level. Having a big tummy down here, right? You got this huge tummy. We convert testosterone to estrogen here in the tummy, and testosterone levels will drop. Right? Alcohol. I hate to break it to you. Too much booze, testosterone level drops. Right? So that's testosterone. So low testosterone reduces your sex drive, reduces your erection. Number two, uh, urination. I'm just covering the two big ones, right? So God is sort of fair, right? He gifted women in menopause. He's like 50, your hormone levels are going to drop. He looked at guys. He's like, you're not getting away with nothing. So at 50, right, all of you are going to get up 3 times a night to pee, right? That's going to come your way. I'm just going to pull up a model here, right? This is just to show you guys. So just a simple thing. Ignore it after this. That's your bladder. That's your prostate. Sorry, where is it? That's your prostate, right? That prostate there. Can you see there's a tube passing through here? That's called your urethra, right? Passes through the prostate. So it starts growing, and prostate for guys is the only thing that grows throughout life. So when you're born, it's about that big. Alvin is 30, so his is that big. I'm 50, so mine is that big, and Mahadev is probably like that. Okay. He's the oldest Malaysian I know, so he's got a giant prostate. Right. So as it grows, there's a tube passing through the center, the urethra. It squeezes the tube. So as it squeezes the tube, you will have difficulty starting to urinate, finishing your urination, and difficulty emptying your bladder. So when we're young, you see my son, he's 15, he's 16, sorry. He pees, right? He can stand 1 mile away from the urinal and he can reach the urinal. If for me, I have to stand next to the urinal, I urinate on my shoes, right? The flow is slow. So the prostate will continue to grow throughout life and it'll cause you urine problems. Now, it is very, 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 very easy to treat. Seriously. So normal and large prostate, all the guys are going to get it. You're all going to get it. But most of us, it grows sideways, so you don't feel it so much. You feel it later in life. Some young guys, it grows inwards, and you feel it earlier. But pretty easy to treat. Treatment is medication. And the good medications, there are two types. They're called alpha blockers or 5-ARI. Alpha blockers and PD5s. PD5s are your Viagra group of drugs. Here's the plus point. They don't affect your sex life. You take these, you have a good sex life, you have good urination. And now they found that most of the drugs reduce your risk of heart attack, number one. The PD5s, the Viagra group, they even may help to reduce your risk of Alzheimer's and senile dementia. Okay? Which is good, which is fantastic. And they maintain a good erection. So easy to treat, easy to diagnose. You start getting up at night to pee, you have to run to the bathroom, you can't sit through a meeting. When you want to start to pee, you have to wait for a little while. Or when you finish, you don't finish completely, go see your doctor. They'll check you and say, look, you got big prostate, take this med. Easy, easy. Now, of course, there are some of us who are very kiasu who believe you should not be like other people and you want to stop your prostate from growing. Okay, bad thing, right? If you try to stop the prostate from growing, you need to block the main hormone, testosterone levels. And you do that by taking things like saw palmetto, pumpkin seed, or a drug called 5-ARI. And I use all this for much older patients. Yes, the prostate will shrink. Bad, you just block the active component of testosterone. So you lose your sex drive. You'll have a decrease in muscle mass. You'll not. There are a lot of side effects to blocking the active form of testosterone. So you shrink the prostate and cause another problem. Right? So I'm trying to tell you, if you have enlarged prostate and you're a young guy, just take something simple. You'll pee well, have a good erection, continue with life. 90% of people will live long, healthy lives with no problems on this med. 10% may require surgery for prostates. Again, it's just a simple laser surgery or shave the center of the prostate, you're done. Okay, that's the good news. Bad news, the commonest cancer for guys is prostate cancer. Worldwide statistics is about 15%, right? That means if there are 10 of us in a room, one of us is going to have a cancer. We can pick it up fairly easily. It's just a blood test. That means you come in, you do a blood test, and we ask you to do a blood test usually about 45. If you have family history of cancer, we do have 40, but if not 45, it's fine. Just come do a blood test. The blood test will say, yes, you are increased risk of cancer, no, you're not. Increased risk of cancer, go do a biopsy. A lot of guys hear the word biopsy and start freaking out. It's not painful. We do it under anesthesia. You're asleep. You wake up, nothing. Okay. Get your biopsy results and it'll tell you you have cancer. And if we pick up a cancer on screening like this, right, it is very, very, very curable. All right. Most of my patients will live same like someone with no cancer. They have to go through the treatments, but their lifespan is pretty good. That is for those who are picked up early with early PSAs, early cancers. But even if you're picked up late, prostate cancer is one of those that can be controlled pretty well. So there's a lot we can do. So a men's health issue that concerns my patients the most is their sex life and their prostates.
What's the youngest patient so far come to you, doctor?
For what? Prostate? Enlargement or prostate cancer?
Enlargement.
Enlargement is about 40-ish, 42, 43, a bit abnormal. But there are a couple of them where the prostate grows inwards. Okay. Youngest patient I have with cancer, probably 49. Okay, but Alvin, you're blessed. We are Asian. So Asians have lower risk of cancer, right? God likes us. We shouldn't say that. Okay. So Asians have a lower risk for some weird reason. We have a lower risk of prostate cancer. All right. What else now?
But doctor, even with lower risk, because I know someone who was recently diagnosed with prostate cancer.
Right.
He's close to 70, and he has to undergo treatment in Institute Cancer Negara. Now, right. in terms of just now, you did mention about the mental attitude. How or what can we do to actually support people who are,
Okay.
all these while they are healthy, and then suddenly they get bam hit by such news. Yeah.
So I just saw a patient earlier, 40 something, and I told him may have blood cancer actually, strangely. And the first question is, shit, I'm dead. I mean, that was it. I got cancer, I'm dying. Right. Number one, not dying now. Okay. Depending on the type of cancer, depending on what you have time. Okay. So let's do best case, worst case. Right. Best case,
Yeah.
worst case. All right. Um, for the cancer treatments, no matter what kind of cancer treatments, they're stressful. Being told you have cancer is stressful. I disagree with doctors who do that. Doogie House, not Doogie House, House MD kind of thing. Hi, you're going to die in 3 days. All right, or you're going to die in 6 months. Not very helpful. Telling you you're going to die in 6 months makes you look at the clock. All right. So worst case scenario, someone says you have a cancer that's spread. We can't treat. We can't do much for it. So my way is, do you have something you want to do? Is there a cruise you want to go on? Is there a wedding you want to attend? Is there a grandchild's birth you want to see? And we aim towards that, and we keep you as comfortable as we can. So being negative about it, like, oh, you're going to die in 6 months, is not it does nothing. It's not going to contribute to your health, right? In no way is it going to help you. But having an objective, understanding where you want to go, already changes your mental outlook. Okay, I'm going to stay alive to attend this wedding. I'm going to stay alive to see my grandson being born or my son being born, whatever it is. Oh, I'm going to live long enough and take all this money I'm going to waste on chemo and go on a cruise. Okay, fine. I've actually done that. I've actually told patients, look, this chemo is not going to do much. Because sometimes our drugs just prolong life. They don't change. They give you a bit longer, but you have poor quality. But you may want to just use the money and go for cruise, go enjoy yourself, right? Relax, because it's not going to change anything. It may increase your life by 20 days, and you may spend 200,000, literally 200,000 a month, to live extra 20 days, or you take the 200,000 and go on around the world cruise. Up to you. So you don't have to be negative about it, and your doctors, the new generation of doctors, are not. And I always tell people, look, this is for the worst case scenario. I can't help you, but is there something you want to do? And let's go towards that. Okay. Most people, thankfully, are no longer in the worst case. With the screening programs, I pick them up pretty early. So best case, you walk in, you have cancer, right? So the first thing I tell, look, you have a cancer. Let's find out what it is. Let's find out what stage it is before you freak out. And there are treatment options. I'm not going to guarantee they're all going to work, but for the vast majority of people, it is going to work. Okay. Yes, it is a hassle. Yes, it's a nuisance. Yes, you have to see my ugly face every day for the next 30 days. Too bad. But you are going to be around to see your kid graduate. You're going to be around to see your grandson being born. Okay, but it's a pretty long journey. So let's keep that in mind, that you are going to be around. Okay. But we're going to do it step by step. So let's not look too far in the future. Let's not look at all the complications and problems that are going to happen. We take it bit by bit, right? So you're here. We just found out your cancer. Let's see what's the stage. Let's decide on what's the best option. And usually at this stage, I will tell them to get a second opinion. Because I may be biased, right? I'm a surgeon, so I'll say surgery is the first option. So I send an oncologist. Let's see about radiotherapy and chemo. Let's get another surgeon to give you different options on surgery. And I'm okay. I'm perfectly fine with this. And then we'll discuss which one fits you, your mental attitude the best. Let's say prostate cancer. I have patients who die, this cancer must come out of my body. I can tell them it's the smallest, weakest cancer in the world. It's not going to do anything. No, must come out. Fine. Let's do surgery and get it out. Right? Fine. Patient is happy. I'm happy. Cancer's gone. I got patients who no matter what I say, no, we are not doing any surgery. Do anything but except surgery. Fine. Let's do radiotherapy. So it's a discussion, and having realistic expectation. You don't have to be negative about it. Fine. You have a problem. Let's fix it. Goes a long way. All right. So again, like I told you, I'm a firm believer in mental attitude. Someone asked me how do I feel at 50. My answer was, I'm damn happy. I made it to 50. Right? I made it to 50. Right? And this year I'll make it to 51. Hopefully, if I make it to 51, I am damn happy I make it to 51. Because I'm 51, 50, I'm sitting here, I'm talking to you, I'm healthy. I have kids, I'm okay. Yeah, I'm damn happy to make it 51. So I have that kind of attitude for most things.
I think that's really important. The way, like you mentioned, your patient, how you sit and you frame out the whole possible journey with them. I think when, as a patient, when they have more information, when they have the assurance that you are there, I think definitely that's a positive way forward.
Yeah. Because most people, okay, you freak out, you don't know what to do next,
Yeah.
you don't know what's going to happen next. So just being told that look, we have a plan. There is a plan for you, right? We're not just going to throw you out there and go figure things out. There is a plan. A lot of people have gone through this plan quite successfully. So chill, we're going to do it step by step and we'll get you to the end. Right. So yeah, that's how I do things usually.
Absolutely. Now, doctor, my next question to you, right? Of course, we want to avoid having any issue, avoid coming to see you, lah.
Okay.
Is there
Don't do
any
that, compliments.
is there any some of your top advice or preventive measure that like men or people can adopt to just maintain a good overall health as they age?
Right. So okay, I do anti-aging and wellness as well. So this is actually applies to older guys, all right, or older women as well. So I say three things keep you going. Okay, and this is gonna be fun. It's gonna be sex, exercise, and work. Right? So I strongly am against retirement. Having a schedule, having a purpose to get up in the morning, having people to meet, interacting is going to keep you healthy. I'm not talking about young guys like Alvin. I know Alvin asked me the question from his point of view, but I'm talking about older guys. Having a reasonably healthy sex life will keep you healthy as well, and this is proven. Doing any type of exercise activity is going to keep you going. Now, the same the same thing applies all the way through from 20 to 50 to 40 to 60, 70, 80. It's just the intensity that changes. So if you're Alvin's age, 30, you want to keep active, a reasonable working hours, say 50 hours a week, 40 hours a week. If you enjoy your job, you'll do it well. You will probably exercise, say, 1 hour a day. Sex is 3 times a week, or 4 times a week, or daily, or whatever number is, right? You're 60, you're probably going to cut back the working hours to, you're going to make your money, you're due to retire, but you don't want to retire, you still work. So maybe 10 hours a week. Exercise, you can either step up the tempo, that means you do more, but you're doing at a slower pace. So instead of jogging, you're walking, but you're walking more. Or you do keep the same intensity, but you reduce the time, more tolerable for you. Sex is now twice a week, right? So I believe these three things are key to a happy life, and not a happy life, to aging well. So these are three key points. Now, behind there, of course, certain logical things. Food, right? I believe food should be not organic, but as non-processed as possible. So if you're going to eat rice, eat rice. Don't turn the rice into rice flour, which you then turn into mihun and kway teow. Okay, if you're going to eat chicken, eat the chicken. Don't turn it into chicken sausage or chicken burger. Just eat the chicken. If you want to eat beef, eat the beef, eat the steak. Don't turn it into beef bacon. Right? So what I find is the less processing you do of the food, probably the healthier you are, and quantities change. My 16-year-old son can whack through 3 lamb burgers with nothing and be hungry 1 hour later. If I eat 3 lamb burgers like him, my metabolism is a lot slower, and I'll be double my size and I'll sleep for the next 2 hours. Right? I'm not going to move. So you are pretty much, so simplest thing is you're going to eat the food in its most original form. Okay, I'm keeping it simple and real as possible, right? Something most of us can do, right? So if you are going to go eat a piece of chicken and you like fried chicken, fine, eat fried chicken. Don't eat fried chicken sausage. I mean, you're not going to do this all the time. If you go on a holiday, you want to enjoy some bacon, have some sausage, go ahead. I'm talking about your day-to-day routine. Now, That gives you your protein and your essential fats. You need the second most important thing in your health is fiber. Okay, not nutrients, not nothing else, fiber. So each of us needs about 30 odd grams of fiber, right? So one banana, 2 grams of fiber. You can get fiber from oats, you can get fiber from fruits, you can get fiber from vegetables. So somewhere in your daily routine, chuck in some fiber. I this is going to sound like bad advice from a doctor. I hate vegetables. Okay, I loathe the vegetables. I can't eat the damn things. And if my wife is watching this, she's like, "You just give bad advice to the kids." I hate vegetables. But I know I need fiber, right? I know I need the stuff. So what I do is I take all these fresh vegetables, I chuck in a blender, I chuck in some frozen berries to hide the taste and a lemon and boom, talan, 30 grams fiber, done. Okay. That's one way to do it. But you can also get fiber from fruits. Just vegetables have more fiber, fruits have less fiber. So if you're going to replace it with fruits, eat more fruits. Like I love pineapple, so when I eat a pineapple, I eat like literally entire pineapple gone. Poof. But I need to get fiber. So simple fruits and starches you want it in its most original form. That means rice is rice. Don't turn it into Mihun or kway teow. Fiber, fruits and vegetables. You want to make it more complicated, it is a lot of people can't afford organic. Organic is freaking expensive. You want to eat at home every day. How many of us can eat at home every day? Do we have the time? I don't have time. I end up eating in the hospital most of the time. But I can make these little conscious choices. So instead of McDonald's, which okay, shit, did I just mention brand name? But anyway, instead of burger patties, I take meat burgers, like fresh chicken slices on a burger. It's a simple choice. Of course, the bun is bad, but I don't have time to eat rice, so fine, compromise. So I do my best within what I can. But these are the general guidelines. You want it in original form, you want fiber, right? And strangely, if you get enough fiber, you also get most of your daily nutrients. Easy. Water is the next big one. People always ask me, how much do I drink? Heck, if you run 30 kilometers a day and I sit in the office, both of us have different water requirements. It can be the same size, same shape, different water requirements. Don't measure. Look at your urine, look at your thirst. You're thirsty, drink. Don't delay. If you look at your urine and it's this, okay, hold on. Looks like my nameplate here, right? Yellow color, you're dehydrated, right? Easy. Morning urine is always this color, but the rest of the day, this is not the color you want it to be. You want it to be this light yellow color. So light yellow urine. If it looks like tap water, you're drinking a lot of water, you pee more often. No harm, just irritating. Light yellow color, you're done. So Muhilan's advice for diet is not is doable. I most of my advice is targeted towards being doable, being something that people can do. I don't know
Love
if
it.
that- okay.
Love it. I'm going to put all of this in the show notes. So basically what Dr. Muhilan said is eat single ingredient food and lesser multiple processed ingredient food.
Yeah.
That's it. Easy. I can do that. Now I know what I'm going to eat for lunch later, doctor.
So because what I find is when I look at health shows, right? They give you this list of ingredients and they give you the list of items and tell you don't eat this and don't eat that. And I always ask myself, looking at that list, can I do this day in, day out without killing my career and without killing my budget?
Yeah.
And most of the time the answer is no, I can't do that, right? I can't go home for lunch and cook lunch. I would love it. I would love to go home and get my wife to cook for lunch. If I told her to cook me 3 meals a day, she'd kick me out of the house. But right? But I have 2 kids. She's got to babysit the kids. She's running around sending the kids. So I can't. So whenever I looked at a lot of advice on the internet, I find one, it's too narrow. They tell you eat this, eat chia seed, eat this, or it's too broad and eat organic. I can't do that. And where the heck am I going to find an organic restaurant next to my hospital? I'm not going to find it. So I decided to come up with Muhilan's formula, which is that. I think it's doable, right? Realistically, guys, what do you think?
Yeah, I think the key thing is very sustainable. That's the most important.
Yeah, because even if you go to Kedai Mamak, okay, you can still have bread. You can have white rice. There is chicken gravy. There is fried chicken, and there is vegetables. Don't stress too much on how it's cooked, whether it's oily. It's what you can afford. It's what you can have. It's healthier than processed sausages, right? And if you're Chinese, go to Chak Fan shop. They have enough ingredients. You don't have to take the spice sausage. There's always fresh food there. There's some vegetable, there's some steamed chicken, fried chicken, whatever, with rice. Easy. And every shop nowadays has a fruit seller selling some fruits. Has some fruits. It's not going to kill you.
But not durian, huh? Durian
Oh.
shouldn't be the
Hey, come on.
be the option.
Okay. I would love to tell you, I agree with you. I love durian. Mesti makan, but I can't explain it, and science can't explain it, but durian is incredibly heaty. It sounds like I'm a witch doctor or something saying heaty, but it is your badan jai panas, and your sugar climbs, but it tastes damn good. So, look, I'm a Malaysian, I love durians. When I was, like I said, young, I could eat durians every day. Now, okay, fine. I know I can't handle this every day because I get hot, I get flushes. So I have durian once a week. Am I still going to eat my durian? Of course, I'm going to eat my durian. But tone it down. Instead of 5 durians, I down to 3 once a week. Okay, I stick it durian.
Yeah.
Okay, so
Doctor, I have one last question from me at least.
Right.
You mentioned just now that you have issues with cholesterol and you are also diabetic, but
Right.
you're getting that under control. Now, listening to what your options for dietary requirement, I can see why. But the thing is, I also noticed that people who are diabetic, they have this very low they cannot see sweet stuff, like teh tarik definitely the how can we help them to stop thinking about it or to stop, I get scared when I know they're diabetic, and yet they're the one taking the teh tarik and the cakes and the boba and the whatnot. I get scared. Is there any way that you
Right.
can share with us?
Okay, two things here. This is a bit a long topic, but it's important, right? Number one, every artificial sugar on the planet right now, there's a lot of controversy about it because it actually damages your DNA on a basic level, and there's a link to cancer. So that's all your artificial sugars, even your zero Coke, zero whatever crap. Please, Coke, don't sue me. Okay, that's a name that popped in mind. But what I mean is low sugar products. I hate low sugar products. They've never been shown to reduce diabetes. They've never been shown to reduce weight. Okay, number one. Number two, there's a theory that there's an imbalance in your body. So what your body actually wants is protein, but it can't get protein, so it makes you eat until you get enough protein. So, for example, your body wants protein, but you're busy eating buns. There's very little protein. You keep eating those buns and finishing it off until you get enough protein, which is what your body actually wants. So, telling someone you're going zero sugar, not going to work. People just develop cravings. So, certain things will cut down your urge to eat. So, I tell people to start with that. So that's your protein and fats. So having a nice piece of chicken, yes, you still have the urge to eat, but how much you can eat after eating the chicken is less. Okay. Fruits are an alternative. They're not perfect. Okay, my answers are never perfect, right? My answers are doable, right? They're not going to be perfect. I'm a diabetic. I have the urge to eat sugars all the time. So, but I love fruits. So a mango beats a candy bar, right? As long as I don't juice it. You cannot juice fruits. You got to eat the fruit, so you can blend it with all the fiber. That's fine. It's not perfect, but it's okay. So you're going to replace it with fruit. Okay, and you're going to cheat on the sugars. So if you say your teh tarik, you're going to not say zero sugar the teh tarik. You're going to kurang manis the teh tarik. 3 weeks later, reduce the sugar level again. So you never go 100 to 0. You just never craving. So let's say everyone, they're having a teh tarik, right? Don't finish the glass. Drink half of it. So I told my wife, it is cheap. Okay, this is going to sound really, 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 really bad, but it's the truth. it is cheaper for me to throw away half my plate of food than to eat it, because the health cost is much higher than me throwing away half a plate of food. And when you're hungry, let's say buka puasa, right? When you come back buka puasa, the urge to stack your plate with full of food is because your body is low sugar, you're craving for food. You know you're not going to eat that much. Mentally, you know, but you're still going to stack your plate with this much of food. And you're going to try to finish that food because it is built into us not to throw away the food. First thing I tell you, throw it away. You're diabetic. You want to order a teh tarik? Go ahead. Order a teh tarik. Don't finish it. Chuck out half of it. You order the kueh lapis. Lovely. I love kueh lapis. Don't finish it. Half. And one of the things about being a dad, when your kids don't finish their food, that expensive meal you just bought, the wife will tekan you to habiskan the makanan. She won't makan. She'll tekan you to makan. Okay? Why? Come on, Soraya. You know that's true.
No, because my husband's small eater. I'm the one finishing his food.
Okay. So, I will tell you, look, I know we all have control issues. You go sit down in a shop, you want to order a lot of sugar, a lot of sweet things. It's difficult. Be realistic. Chuck it out. It's okay. Let's say I got one nasi lemak on my plate. I will makan a nasi lemak. Okay, definitely I love nasi lemak. But I can stop at half. Stopping at half is easier than stopping without eating. So I eat half, I eat the sambal, I eat the rice, I eat the egg. Nasi tinggalkan and then buang-buang lah. Tak apa. Okay. I know it's very wasteful. I know. But I am telling you what you can do, not what is politically correct, what people would like to hear. I'm telling you what I think you can do. So
Love
when
yourself.
you go to shop,
Love yourself first.
yeah. So you got, you know you're going to order that. Okay, say Mars bar is that big, right? You love Mars bars, right? I love Mars bars. So I'm going to buy it. Fine. It's in the fridge. I'm going to buy it. But I can say I eat half and this much I'm going to throw away. So I just reduced my sugar consumption by 25%. That I can do. But telling me don't eat that Mars bars may not be able to do it. So I will tell people to start with this and remove the sugar you don't miss. So one bowl of rice is much, much better than one bowl of bihun. Contains a lot more sugar. So chuck out the bihun. Maybe your morning coffee, all you're doing something simple. Keep the milk, so you still got a taste, remove the sugar. After 3-4 months, you've gotten used to this, remove something else. Like I told you, I do one change. So my change for this year, no red meat. Fine. So far, mid-June. Going strong. I'm still going without a kambing. Okay. I'm going on holiday in July, so I'll probably have some kambing in July. But yeah, overall, not bad. I don't eat red meat at home. I don't eat red meat when I go out. And yeah, not bad. It's one change, but it will have a huge impact. So diabetics, don't freak out. Don't go to zero. I'm a diabetic. I didn't go to zero. I remove one or two things at a time. Something I don't miss. First, get rid of that. Then something else. Then something else. So now routine, my coffee has been black for last 5 years. 5 years black coffee, no milk, no sugar. It's my routine. Now you put milk in it tastes funny. So that's my advice for diabetes or cholesterol or any other lifestyle condition. Don't try for zero straight off. Again, do what you can. Because anything it's zero change, right? Even a 1% change beats 0% change.
That's true. Right? That's why I like to say, reduction is better than elimination.
Yes.
You don't want to straight away drop because us being humans, right? I think the most difficult thing is the discipline, the self-control. Like having you here and doing these, live shows, inviting experts every month. We all kind of know what to do already. At the end of the day, it's the self-control, the discipline to really see to it.
Yeah, and the sad part is someone who starts very high, we stop everything, stop all sugar. After 3 weeks, when you crash all the way. That means you're like, okay, give up. I'm not doing any of this. Right? So I was doing intermittent fasting. I still do. And one of the things I like about fasting is I do it this week. If I miss a few days, that's fine. I'll just continue next week. I don't just give up totally. I do what I can. If today I can fast 12 hours, that's good. Tomorrow maybe I fast 14. Next day I got no more to fast, don't fast. You know what I mean? Right? Yeah. You do what you can. But do something because any little bit you do is better than a zero that you're not doing.
Yes,
Right?
true,
That's
true,
So
true.
message from Dave, keep it real. Okay, keep it
that's
real.
true.
Let's be realistic.
That's true. We love it so much, Doctor. You share a lot of insight and wisdom with us. Now, the best thing about our show on LinkedIn and Facebook, it stays on social media. So those of you who are watching halfway or missed today's episode can always rewind and listen back to Doctor's wisdoms in the beginning. Now, before we let you go, Doctor,
Right.
yeah, it is. It is. Some of it behind the scene, so I get it before already.
Right.
Anyway, what is the best way for our audience to learn more about you, Doctor?
All right. So, my main practice is in Thomson Hospital, Kota Damansara. Right. So we are currently one of the largest hospitals around, a tertiary care center. Right. There are about 150 hours, so we can cover most of what you do. But if you want to get in touch with me, it's really simple. Just type in my name, Dr. Muhilan, Urology, and I'm not very tech savvy, so all I have is a Google business site. Log on. Uh, all my contact information is there. You can drop me an email, you can send me a message, or just call my nurse and come in. Right? I'm fairly easy to deal with, so just come and let's see what goes on. Right? So Dr. Moylan Urology is the easiest way to find me on the net.
Thank you,
Okay.
Doctor. So all of the links and doctor's detail, I will put it in the comment section in our show notes on LinkedIn and on Facebook. Once again, Doctor, thank you so much for your time and being with us today. We are grateful for you.